All right. Well, we're going to go ahead and get started. First of all, this is my nighttime crew that we get together every couple of months, and when we have our division meetings on campus, I don't like the idea of having this group of people have to come in early or the middle of the afternoon or their night, as it may be, or to drag in sometime late in the morning after they've gone home. So we have these, when we have the division-wide meetings, we have a session at 10 o'clock at night or 10:30 when this group is in working. It's always a little more informal, uh, but it gives us time for good communication. So tonight, I hope don't disappoint you. We don't have quite as much of the give and take, bantering, laughing, and joking that's free form. We can get into that in the Q&A because usually it's a pretty relaxed conversation. So what I'm going to do tonight is, instead of in our normal division meetings where we spend a lot of time about recapping what's happened since we last met, who's new, what are the issues, where are we at financially, we've combined this with the town hall concept. We're doing town halls across all of the divisions in an effort to get as much information to you all as possible, and more importantly, to have you ask whatever questions you want to ask of us, so that we can all have a better understanding of what's going on. We're kind of in a new normal right now. I actually do miss driving down the hill and coming into the basement of the building to see you all. And so I'm sorry that I didn't send donuts ahead this time or cookies that we usually bring, but we'll just have to go without those. So within this town hall format, we have a couple of different things tonight. We have a couple of guests that have joined us. They are joining us, Dr. Force, and Rex is one of my colleagues. If you haven't met him, on the admin council, he's the vice president of health sciences. He's over the KDHS division and works closely with the county health department and is one of our lifelines to information about COVID. We also have Ginny Larimore here from the marketing communications office, and she is the moderator. She gets to sit through all these town halls, not just the ones we have in business and finance, but all of them. And she will moderate the discussion tonight, and I'll come back to her in just a moment. Nancy Fox is from our environmental health and safety group, and so she'll be able to answer some questions as well. And so, hi, Nancy.
Well, hello.
And I think that's all of our special guests. Trevor's on, of course. He's just not with me since we are social isolating. We're not just social distancing. With that, I'm going to have Ginny just explain how the chat function works and how the question and answers will work tonight. And then we'll get into the presentation and then, more importantly, move into your questions. So, Ginny?
You bet, Glenn. So we have such a small group tonight. We do have some options compared to if there's, a really large group and you can't have so many people actually talking versus chatting. But for those of you who would like to submit a question anonymously, what we can do is if you hover over the screen, the Zoom video screen, and click on the icon chat below, your chat feature will open up to the right. And then that's where you can submit a question. Now, I just hit enter on a question to everybody. So that's what it looks like if you send something to everyone. But if you want to send something just to me to ask an anonymous question, what you'll do is pull my name down from the drop down, Ginny Larimore, and then when you get ready to type, you should see my name and then the word privately in red next to it. And if that is the case, then you can be assured that your question will be just to me. And then I'll ask questions from there in order. But again, since this is such a small group, and if Glenn's okay with that, I think it'd be fine to have people ask if they wanted to openly as well. With this group size, I think we have a little bit more flexibility. We are recording this. All of our town hall meetings are being recorded and then put on isu.edu/townhall. And I'll send that to you guys right now as well. So if anybody was unable to make it tonight, we can send them the recording, or you can go back to the town hall site and get the archive recording there as well. Okay, I'll turn it back to you, Glenn. Thank you.
All
Thanks
right,
for having me.
thank you, Jenny. Well, what I'd like to do tonight is start off the way we've started off all of our meetings, and that is just talking about the fact that we're Bengals and who we are, what our culture is, and just a quick update or review of our culture. Shouldn't even say review because I know that you all know this. You know that we have a culture that's based in and rooted in trust, compassion, stability, and hope. And I think what I've seen over the last 4 or 5 weeks is across campus, we have all come closer together in maintaining a lifeline, if you will, to the students and the faculty. Campus isn't closed, although buildings are closed to the public, or most of the buildings are closed to the public. We still have some students living on campus. We still have some students coming to campus in the computer labs. We have faculty who may be teaching their courses from their office or from a computer lab. And so we have to maintain campus and maintain our operations, even though our students aren't physically here, or most of them are not physically here. One of the things I'd like to share is, I'm going to steal this from our provost, Laura Woodworth-Nye, as I've been sitting in on some of her town hall sessions to answer some of the finance questions. For those of you who don't know her academic background, she's a historian. And one of the things that she has pointed out to her groups and that I've learned from as well is, you know, our generation has not really lived through any type of really global disruption like we're experiencing right now. This is different for all of us on a first-hand basis, but it's not different for Americans. It's not different for the human race. Even if we go back to the last century, World War II, which, you know, doesn't seem like that long ago because we see things on the news and newsreels and shows about things that happened in the 1940s, which was 80 years ago. Most of us weren't alive then. And so we didn't have a firsthand experience of what it was like when a majority of the men in our nation were in the military and were either in the European theater or in the Pacific theater. And wives, children, and other family members were left back home to try to keep our economy going. And while it was an extreme hardship for many, many people didn't live through it and come home. But those who were here and kept things going, they kept our economy alive, they kept our way of life alive. And when the war was over, we rebounded. And we're in a similar situation. We are in uncharted territory. We're facing an unknown. And just like then, there are times today where we can have a really good day. And then for no apparent reason, tomorrow we can wake up and just feel awful. And with the pressure, the unknown, worry, concern, you know, can really take a toll on us psychologically. And so I just want you to know that that same thing happened in World War II. It happened 100 years ago during the Spanish flu, and people survived. They came out of it and they continued. Our university, as President Satterley has shared with all of us in one of his earlier videos during the pandemic, there was concern about Idaho State University, which wasn't Idaho State University at the time, but our forerunner, were the doors going to stay open because of the Spanish flu? Were the doors going to stay open because of World War II? And people rose to the challenge, kept things going, and this too shall pass. We're in that environment right now, and we don't know. I'd love to be able to tell you when this is going to get better. We don't know. But we just need to take one day at a time and make the best choice we can each day. And so I think what I have seen through all of this, through those of you who are having to come to campus every day and keep things going, and the other part of our organization who's had to figure out how to work from home, is just a real testament to resiliency and a testament to the culture that we have that's rooted in trust, compassion, stability, and hope. And the one thing we need to do is continue to hang on to hope that as this passes, we will come out stronger. And I think we are coming closer together as a community. So next slide, please. So tonight, I just want to briefly talk about the FY20 budget, an update from what we've talked about in the past, tell you a little bit about the FY21 budget development process, mention what I know about the CEC status, and then we'll address some of the budgetary impacts of COVID-19, of the COVID-19 pandemic. And then after that, we'll move into some other information from Dr. Force. So on the FY20 budget, as we talked last time we met, we started the year with a $6 million deficit, meaning our expenses were $6 million more than our revenue. I also shared with you that we had about a $3 million revenue miss in enrollments, and the governor had requested that we send 1% of our budget back, which is another $800,000. So that meant that this year, if we do nothing different pre-COVID, we had about a $9 or $10 million deficit, and we were hoping through vacancy savings and other measures to maybe bring that down to 7 million. All of that changed on the first week in March, second week in March, when we started realizing that we were going to have to deliver education differently. We were going to have to live our lives differently. But the 20 budget deficit, we had a approximately $9 million deficit. So that was our lead in to building our FY21 budget. But we also knew that for FY21, the governor had reduced our budget and the legislature approved it by 2% or $2 million. We weren't allowed to increase tuition and fees, with the exception of some professional fees or a non-resident fee. And at the time, we thought we would have to fund part of the CEC. So if we put all those together and we look at what the unit submitted to us, we had about an $11.7 or $11.9 million deficit in next year's budget. As we previously talked, the plan was to have a deficit spend for probably 3 years, moving towards break even. Well, obviously, we're not getting closer to zero, we're getting farther away from zero. And so we needed to go through a process to identify what we could restructure, what could we do differently that would allow us to continue to serve our students and faculty members and other staff members at the same level we are currently or have been serving them. And so we started on a process at Leadership Council. Did we just lose everybody at the conference room, or did it move around on the screen? Oh, conference room's there. Okay. I'm sorry. I was afraid we might have lost you. I didn't want to keep talking. So we started a process with the deans and the other division leaders, leadership council, of saying, let's look at scenarios of a 4%, a 5%, or a 6% cut. If we did a 5%, if we had achieved an average of a 5% cut across campus, that would generate about $12 million. So we would essentially eliminate our structural deficit. We've been meeting the last couple of days, and Leadership Council will continue to meet through the end of the week in looking at the proposals that were brought forth. And I can tell you at this point in time, every unit across campus, or every division across campus, both on the academic side as well as the administrative side of our organization, have brought forth changes in the way we do business in an attempt to close that budget gap. And we'll have more information on specifically what that number looks like next week, because Leadership Council is going to make a recommendation at the end of the week to Admin Council. Admin Council will be looking at that over the next couple of weeks to build our budget for next year. Now, in a perfect world without COVID, that would be great. It's a new budget process for us. It's sharing more information than we've ever shared in the past. And we would be addressing the fiscal challenges that we have, because we can't live in deficit forever. Eventually, I think some of you in this room last time asked, when will the savings account run out? And so we're trying to be diligent and responsible and address that. But everything changed the 1st of March with COVID-19. And the governor, well, the state, because everything is shut down, the state is generating less revenue from tourists, less revenue from dining out, less sales tax, and probably less income tax collections. If those go away, the state has less money, which then means the state has less money to provide appropriation to us or any of the other agencies. So in a preemptive, conservative, well thought out policy, the governor has asked us and every agency to hold back or prepare a plan to hold back in another 5%. So it'd be another $5 million. So we started with a $11.7 million deficit a month ago for next year. Now add another 5 million to that. That takes us to 17. We've lost revenue from canceling sessions like Chrome and the Dome and other activities that bring us revenue at Holt Arena. Summer camps that bring students, high school students to campus, that introduce them to Idaho State University, that this is a recruiting tool for us, as well as it generates revenue. Those revenues are gone. So we really have about an $18 to $19 million problem to solve. So right now, Leadership Council is working on that, but it does mean that we will have to have significant cuts across campus. So what does that mean to all of us in the division? I've had some emails and questions come in before our session tonight. I just want to address a few of those things. The first is, are there layoffs and furloughs planned? At this point in time, we don't have any furloughs planned, but our sister institutions have announced furlough plans. We are each in different financial situations. We will be having discussions at Admin Council about what a furlough plan would look like if we have one. But at this point in time, we don't have one. Given the magnitude of what we need to solve, it's likely that though a furlough would be seriously considered as one of many mechanisms to solve our problem. In terms of layoffs, there is no mass layoff plan. However, as each of us looked at ways to do business differently in our divisions, it did result in the elimination of vacant positions, and it is also going to result in the elimination of some positions. If they're a non-classified position, the non-renewal date is next Monday. So those would happen fairly swiftly. In fact, most of our division employees who are impacted by that have been notified. And then there will be several classified positions that we've proposed to eliminate, but they're across the organization. Will parking passes be reimbursed during stay-at-home? We had said earlier, we had said no, they have not. They're not going to be reimbursed. For most of you on this call who are working on campus, it's a non-issue, I believe, for you. But we are not planning to reimburse people for the 5 or 6 weeks that we've been closed at the end of the semester. Will there be hazard pay for essential personnel? You all are deemed essential personnel. The state does not currently have a mechanism for hazard pay. Yeah, we have not discussed that, but it's something that I told our earlier group today that I would bring that to admin and council to share the concern that some of our staff felt that there should be hazard pay for essential personnel. And then finally, what are our enrollment projections looking like? Because that is the big unknown. We know we can lose some revenue if we don't have some of our events. We know right now we've lost some revenue because most of the students have moved out of the residence halls and are not currently paying us for that last 5 weeks or 6 weeks of room and board charge. But what we don't know is what enrollments are going to do this fall. In talking with my colleagues around the country, people are talking about reductions. Actually, some people believe there may be an increase in students next fall. Most people are planning for the worst, hoping for the best, and are saying maybe a 5 to 20% decline in enrollments. Right now, we're taking I wouldn't say a wait and see approach because that implies we're doing nothing, but we are clearly looking for data to give us some sort of direction because there has not been a lot of data on what's going to happen this fall because this fall hasn't occurred. I can tell you that as of this morning, though, our admissions are up 140% over where they were a year ago. But we have to turn those admissions into students. Next slide, please. And now what I'd like to do is to walk or open up some of the questions related to essential personnel and the CDC guidelines for essential personnel safety. One of the questions that I have received over time, particularly from our facilities organization, is why are some staff essential and are still reporting to campus? The state of Idaho and the governor's order identified who are essential personnel, and our custodial staff, our facilities staff, our IT staff, and our public safety staff were all deemed to be essential personnel by state government. Further, if our campus is open to serve those students who don't have internet access, who can come into the labs, faculty who may need to get into their lab for research, or may need to get into the lab or their office just to get on the internet to teach their class. We have a number of those types of situations, as well as we still have a handful of students living on campus. And we have several computer labs set up on campus in addition to the labs in the parking lots, or not the labs, but the wireless access in the parking lots. So we have not closed. While our buildings are closed to public access, the university is still open. And so that's why some of you are still being asked to come to campus. From a landscape services standpoint, we can't just let everything go. And at some point in the future, when we come back, try to start from scratch with landscaping. For those people who are required to or need to come to campus to work or to access the internet, we need to make sure that they have a clean, safe, and well-maintained environment. So it's not just that the governor deemed certain types of individuals essential, but it's giving our service to the students. So with that, I'd like to turn this slide and the next one over to Rex, and then we'll open it up to questions.
Thanks, Glenn. As Glenn said, my name is Rex Force. I'm Vice President for Health Sciences, and I've been helping to kind of coordinate the university's activities with the Public Health Department, as well as utilizing other, I guess, medical and public health interventions on campus to help deal with the coronavirus outbreak. One of the things that I think is important to talk about is social distancing and the use of masks. We are recommending that folks use masks, particularly if they're going to be in relatively close proximity with other individuals in the work environment. And that's really within about 6 feet of one another. These masks are available through your supervisors, as well as through Environmental Health and Safety. And Nancy Fox is on the call with us today. Nancy and her team have been collecting personal protective equipment like masks and gloves and face shields and that sort of thing for use when it's appropriate. We also have those materials available for folks that come in contact with individuals who have suspected infection. This is most likely to be representatives from public safety, but could also be RAs and other people who are working in the dorms or people working within our healthcare clinics. And we have, I guess, a higher efficiency mask called an N95. It's a fitted mask that fits very tightly on the face and filters out an even higher amount of potential virus or other contaminants. We also have goggles and gowns, as I said, for folks that are coming in contact with suspected cases. And then for custodial or maintenance personnel that are working in the medical clinic, we do recommend the use of a surgical mask and obviously gloves in that situation. Most of our clinics, other than the University Health Center, are either just serving emergency cases. That's the case in our dental clinic, for example, or are not actually treating anybody at the current time. But in some of those cases where they are seeing patients, cloth masks are advised, and certainly we ask folks when they enter University Health, for example, those people will be asked to put on a mask if they're coming in seeking treatment. There are, I guess, a lot of questions that have come up recently about where we are in terms of reopening the university and where we are with regard to the governor's stay-at-home order and how all this fits together. It really depends a lot on the prevalence and incidence of disease in our local community and obviously the wider region and state. We work closely with the Southeastern District Health Department. The health department represents about 8 counties in southeast Idaho. We've had less than 10 cases of COVID-19 reported in Bannock County. And here in Pocatello, we have had at least one case confirmed here on the Pocatello campus. And you may recall that the first case in the state of Idaho, way back on March 13th, I can remember that because it was Friday the 13th, was on our Meridian campus, and was a case that occurred in one of our students who had traveled to New York City. And you know, we have been lucky thus far in Southeast Idaho, but that's partly an artifact of how much testing has actually gone on. And a very small number of the tests that have been done statewide have been done in our area. So as we talk with folks at the health department, they're not particularly confident that we've caught all the different cases that are actually occurring in the community. Obviously, if people present to the hospital and are quite ill, those people are tested and have been counted in the totals thus far. But as you all, I think, have probably heard, many cases have very low levels of symptoms, or maybe even very few symptoms at all. And obviously not everybody is being tested. We are right on the verge of opening up a testing clinic on campus. That will be a drive-up clinic where folks will be able to be tested right in their automobile or vehicles, and then the tests will be run in a relatively short period of time. Testing is typically between 2 and 4 or 5 days to get the results back. We're hoping to even have that testing turnaround be potentially less than that. And we're doing this in conjunction with the health department and a company called Express Labs. All of this is very important to determining when we're going to reopen campus. And so you all know we're at a stay-at-home order until the end of this month. At that point, the governor and the public health officials in the state will evaluate where we are in terms of the illness, and hopefully that continues to be on the decline, which it has been on the decline over the last week or so. But even if we are seeing significantly fewer cases, that doesn't mean we'll just flip a switch and we'll all be coming back to work and everything will be back to normal. The concern is if that were to happen, then we would likely have a surge of cases that would necessitate isolation again. So it will be a staged implementation of reopening that will go from the state that we're in now, where we're basically shut down in terms of face-to-face activities, to slowly increasing the amount of interaction that we have, but also paying very close attention to those folks that may have significant risk factors for more severe illness should they become sick, and also paying very close attention to the rates of testing and the rates of tracking of new cases that occur within the communities. So when the public health officials look at the ability for a community or a state or even a university to reopen, there are many different factors that go into that decision, not just how much illness is in the community. So it will be, I guess, a sort of complicated equation that we work through to figure out just exactly when and how quickly the university will open up. Even if the governor lifts the stay-at-home order around the 1st of May, it will still be many weeks before we are back to full operating potential, and that's if everything goes perfectly. Most of the public health recommendations right now are that would be a phased reopening of the university and our communities overall over a period of, say, 8 to even 16 weeks. So it will take some time, and we'll be well into the summer, even in the best of circumstances, for us to be moving back towards being fully open and not have any restrictions, being back to normal, so to speak. Were there other talking points on the next slide, Glenn? I think you're still on mute. Is Trevor here? Trevor, did you want to go over some of these documents with folks? I think, Glenn, you're on mute.
Sorry.
That's okay.
Yeah, Trevor's having some connection difficulty.
I could go over that briefly if you want, Glenn.
Okay, sure, Nancy. That'd be great.
We won't go into detail on it, but this will go out to supervisors and whatnot. But what EHS did is we used some information from OSHA and from Centers of Disease Control and Prevention and just put together this table to look at different workers and regular duties that you're doing and maybe COVID response or emergency duties. And so mainly for you all, you're doing regular duties. And so it's the social distancing, the cloth face coverings, and personal hygiene, that hand washing that public health keeps recommending, why our hands are really rough and cracked because we're washing our hands all the time. And that if you have PPE that you're using for something already, like those guys doing the chlorine fogging or asbestos workers in facilities, that you're using that. So we just tried to go through all the different types of workers and different job categories and put that in there and give it a risk rating. So since this is a question and answer thing, we won't go through it in detail, but you should have a chance to look at it. And it will be made available.
Okay, thank you, Nancy. What I'd like to do now at this point is move into any questions you have. They don't have to be specific towards COVID and health related. They could be financial. It could be anything. We could talk fishing again about American Falls, but since we have some guests that have stayed up late to be with us, I don't know that we probably should do that. But you can either ask questions, Jenny. They can all unmute. Is that correct?
Correct.
Yeah. So you could either ask a question or you can send a question in to Jenny.
Okay, Glenn, could you please elaborate on CEC, the change in employment compensation, and what that means?
Yes, thank you. I skimmed over that. I'm sorry. The change in employee compensation, which is set by the legislature, and that's what drives our annual increases every year. We received notice late last week that there would not be a CEC package this year, even though the legislature had approved a CEC package for state employees. That approval by the legislature was pre-COVID. So one of the responses to the declining state income and just the fiscal situation the state is in is to not allow increases. Furthermore, the Department of Financial Management and the Department of Human Resources are scrutinizing every single hire, every single promotion, if any promotions. Any pay adjustments need approval from the state, where in the past we have not had to do that. So it's really putting a damper on our ability to do any sort of pay adjustments, and it essentially eliminates the CEC for this year. I mean, that's in a nutshell where we're at with CEC.
That's all the question that we have, the only question that we have right now, Glenn.
Can I just make one comment that I forgot to make quickly?
Sure, Nancy.
I forgot to mention that the face masks that are available and that will be made available, they're really not considered personal protective equipment. They're basically so that when you guys are sitting there together, if you have a mask on, you're preventing each other maybe from getting sick. So it might offer a little protection to you wearing it, but it's to also protect the people around you. And if the CDC is recommending it, because if we all do that, when we can't maintain that social distance, or when we're in the grocery stores and those places, it will impact that transmission rate. And they have this term called crush the curve. So trying to crush that transmission curve. So that's the main purpose of those masks. So I just wanted to get that in there. Thanks.
I have told everyone that you are my most talkative group. When we have these sessions, we have more interaction. And it's just fun being in here at night. You guys are quiet tonight. And I know it's a different environment, but I'm sure you have questions.
I'm not sure if they have the ability to ask a question.
Yeah.
They might have to type it in, and since they're in the conference room there.
Oh, no, they talked before you got on, Cheryl. We were talking.
Oh, okay, good. All right.
So they're just are pulling the wool over your eyes.
Yeah, we're working off a laptop tonight.
But we can hear them. So
Do we get testing, or do we have to
Do employees
pay, or-
get free testing?
No, there's no free testing at this point. Are you responding to the Idaho State Journal article about the drive-up tests that may be given?
Like, can employees do that? Is it provided for them free of charge, or?
No, Rex, do you want to respond to how Dyer that process is going to work at Dyer?
Yeah, as I understand it, and I'm not, I don't know all of the details regarding billing and charges, but as I understand it, there will be a charge, and there will probably be a screening process so that people will need to meet certain criteria to be tested. If you feel that you need to be tested, and usually that's because people aren't feeling well, even though we know that the disease can be spread by people who are feeling just fine, you're best off calling University Health or calling the Southeast Idaho Public Health Department. They'll likely ask you a few questions about your symptoms or otherwise, and then if you meet certain criteria, they will offer testing. That testing does cost, I think what I saw was $95 per test, but insurance would also help to cover that. So there's no free testing at the current time, and really testing is primarily for those people that are exhibiting symptoms or have been in close contact with people who are exhibiting symptoms.
Thank you, Rex.
Does our insurance cover the test if needed?
It should, yes. There may be co-pays, and I don't exactly know. You know, each individual may be different in terms of whether you've met your deductible and other things like that. But there should be a way for it to be covered with your insurance.
Cheryl, is that something that you could check in with Brian tomorrow and then get back to the team?
Yes, I'll do that.
Thank you.
And just to add to that, once again, if people are feeling ill or exhibiting some of those symptoms of COVID-19, and that's a cough, fever, body aches, those kinds of symptoms, we would ask that you contact University Health or your primary care provider. But University Health is geared up and ready to support the university community should folks have those symptoms. And they'll be able to work with your insurance, provide the care that you need, provide recommendations and testing as it's indicated.
So I think I'm learning my lesson that it is the cookies or donuts.
No, it's don't invite Rex to your meeting, Glenn.
Oh, is that it? Rex is our buzzkill.
I'm the wet blanket.
I mean, you don't have to ask questions either, but Is Tim going to say something?
Well, I was going to tell you that the Madison's open for fishing, so.
Oh, okay. Thank you.
Questions come up at other times. Again, I put a plug in for University Health. They're there to answer questions. And the Southeast Idaho Public Health Department has a COVID hotline that's frequently being staffed by some of our nursing students and other health profession students. And they can help answer questions and refer you for the right kind of care. So, if you're not getting answers, reading about it on the internet or other places, or if we can help supervisors to answer questions, we're happy to be there. And you can contact University Health or the health department about COVID-related questions.
I can't say enough about how much I'm appreciating everything you all are doing. I've told you that in the past in the pre-COVID environment, that you're kind of our unsung heroes. You're the ones that make sure when people come in the morning, they come into a clean office, they come into a nice environment, and it makes them much more productive. And this time period is no different. And I continue to just be impressed with the quality of work that you do, the space that you cover. And at this point in time, I guess my question then is, if you don't have any questions yet at this point, I guess there is one that came in. We'll come back to that question. I'll finish this thought. I want to hear from you about what can I do, what can Cheryl do, or Trevor, what can our leadership team do for you, if anything, at this point in time. But you can think about that one while we have a question, Adam's question.
I would add one to that too. If there's anything that marketing and communications could do to make things clearer or communicate better to campus, we'd love any feedback on that as well. And the question is, if we're diagnosed with COVID and have to quarantine, do we use sick time to cover that, or is there special leave?
That is, I should know the answer to this.
Glenn, I'm not aware of any special leave accommodations that have been established. And most folks will likely have to take sick leave for that, as far as I'm aware. I'm not aware of any special leave accommodation.
I think we've been given an extra 80 hours for COVID.
So what I know about this is you have an 80-hour bank. In other words, if you don't have any leave saved up, they're giving you 80 hours in advance that as you accrue leave and you get well and you come back to work and you would accrue leave, you would replenish that bank, but that you would have that 80-hour bank and not have to take leave without pay.
Now, that being said, if any of you are in a situation where it looks like you're going to go negative on sick leave, please notify your supervisor. Your supervisor will run it up to Cheryl so that we can put our heads together to put you in the best possible situation. The last thing I want any of you to do is to come into the office sick because you're worried that you're out of leave or you're not going to receive pay. I want to at least alleviate you of that burden. We will figure out something to help guide you through that. So don't try to do it alone if you are sick. We don't want anybody here to spread, correct, Rex and Nancy?
Yeah, absolutely right. And now that you say that, there are actually new rules and relaxed rules for folks to be able to donate sick leave or vacation to those who don't have it. Cheryl's right. There's an accommodation for an additional 80 hours, but there's also this relaxation of the old policy where we couldn't donate sick leave to people to replenish their sick leave. Now we actually can. And so there are several mechanisms for us to help folks out if they run out of the 80 hours plus what they already have.
So again, if there's any concern, don't come in because you're afraid you don't have the leave. Talk to your supervisor and Cheryl, and we'll figure out something to help you.
Yeah, it's actually the worst possible scenario for people to come into work and mingle with others if they're not feeling well. We definitely want to avoid that.
So back to my question, is there anything we can do for you? Or as we've talked about before, are there problem spots we need to be aware of? I'm guessing that the pizza party, infamous pizza parties in the library that you used to tell me about may have ended right now. But do we have other problems like that?
Not
No,
so
there's no
far.
problems because there's no one there.
Well, I'm just checking because, when we do have a few people coming in and out of the buildings, and you never know. But again, if there is anything, I can do, or Cheryl can do, or Marcom can do, just feel free to send me an email as well. You don't have to say something tonight.
We have a question. How does the FFCRA affect ISU in regards to leave for COVID?
I didn't understand the first part of that.
How does the FFCRA affect ISU in regards to leave for COVID?
Is that the Family First Child Care Act?
Yeah, so what I know about this from talking with Brian is that there's a new provision for if you apply for FMLA, usually you have to use your own, exhaust your own sick and vacation leave first, and then if you run out of leave, you don't get paid. But with this new act, they're offering partial payment for those that need to take care of someone who's sick and homeschool, etc. if you apply for FMLA. So it's only an FMLA application type process if you're familiar with that, but it does allow for a partial paid leave only during this time that the governor has prescribed. So I think you get like 2/3 of your pay.
Thank you, Cheryl.
This next question is probably for Rex. Is it true that because we are practicing social distancing and better hand washing, the regular flu has also lessened in the area?
Yeah, that is true. In fact, I was talking with Dr. Solbrig, our director of university health, the other day, and regular flu, even head colds, even mild illnesses, which are also usually caused by viruses, have decreased. And so that's further evidence that social distancing works, increasing hand washing, paying attention to where our hands are, not touching our face frequently, not shaking hands, all those kinds of things have really made a difference. And the University Health Center, they're sort of twiddling their thumbs right now because they really haven't had a lot of action. Obviously, they don't have many students on campus either, but they're not seeing nearly the number of other illnesses, and it's likely because of these same measures that we're using for COVID will work to decrease the transmission of other viruses like the common cold and influenza.
Okay, another health-related question. If testing isn't being done completely and people have been asked to stay at home and recover, do we really have a good idea of what's going on with coronavirus?
So the short answer to that is no, we don't have a complete picture of what's going on with coronavirus because we, at the initial time back in March when we were really starting to ramp up cases, testing either wasn't available quickly or it wasn't available at all, and they were rationing the testing kits. And then it was taking a long time for tests to turn around. When we had that first case on the Meridian campus, we had a bunch of other people that were potentially exposed. A couple of them were not feeling well. They were tested, and we didn't get test results back for 10 to 14 days. So it was very difficult for us to be able to follow up on the contacts of the contacts of the contacts when you don't even know who's positive for up to 2 weeks. So we really don't have a clear idea of who has been infected. Those people that are severely ill and present to the hospital, we usually have enough testing capability to figure it out in them. But as you probably heard in the media, a lot of people have mild illness or may even be asymptomatic. So we won't really know how much disease has been present in the community until we do studies of antibodies. And antibodies are the response that our body makes to an infection like COVID. And there will be studies done, maybe not totally across the country, but there will be studies done where we'll be able to have a better idea of the actual incidence of disease, those who present with mild symptoms, moderate symptoms, and severe illness, and some unfortunately ultimately die. And we won't have a good handle on all of that for probably several months until all of those studies can be done.
If there's another coronavirus case found on campus, will we close?
I think this is probably a Rex one as well.
So I don't think that just with another coronavirus case on campus we would automatically close. I think what would have to happen is we'd have to look at the circumstances around that case. If we were back to fully functioning, let's say we're back in the fall and we're back to normal operations, and knock on wood that actually happens, and we were to have a case, we would have, I think, a very robust and rapid engagement with the public health department. They would do very aggressive contact tracing. They would do all kinds of follow-up to figure out where that person got the illness, who they may have been in contact with. And if we had all of those systems in place, it may prevent us from having to close down again. I think that a single case is unlikely to do that, but if we were to have a cluster of cases, or if we were to see increasing community spread, it would affect our ability to reopen or to stay open.
Well, if there's no more questions, we'll go once, twice. You're going to have to get back to work. I know you guys don't like to come together when I force you to come together like this. But I really do, seriously though, I want to make sure that when you guys do get in a conference room like this, I really do want you to be practicing the social distancing, the masks, some type of face covering. I think it would be a wise thing to do. If you're out there by yourself cleaning your building and you're by yourself, that's a different story. But I'm just a little bit nervous seeing you all in the conference room tonight together. I know it's your choice, but I get concerned. So.
And then Glenn, if you'll hang on, someone let me know that they're going to be sending me a question shortly.
Oh, okay. Yep.
I'll just say another thing. I'm very proponent of the face masks as well. I have one hand sewn one. I have one that I made from a bandana. I don't know if you've seen the way to make one from a bandana and little hair bands. That's the one my husband will actually wear. You can kind of adjust it. There you go. Thank you, Glenn. I thought you would do. Thank you. See, and those are quite comfortable, and you get multiple layers, which we like in a face mask as well. There's also one where you can cut up a t-shirt, and I'm going to try that one this week. And so I'm actually going to come out next week and visit the custodians at night to see the chlorine fogging that they're doing. And I'll wear my t-shirt mask, and if I see you, you can see my t-shirt mask. But so there are lots of things that you could make a mask with. We do have some available, and we'll be getting more of them, and they'll be requested up through your supervisor, through Cheryl. But so anyway, and is that pretty comfortable?
Yes. I have to say yes because my wife made it, but no, it is comfortable. And I think Dr. Solberg said that he had been experimenting with these cloth sewed masks, and instead of having the elastic ear bands, that he put some kind of Velcro straps on it. So this thing's comfortable. I carry it with me, and when I go to the grocery store, the few times I venture out in public, I go ahead and I have it on.
Yep, I use mine too. It protects me and it protects those around me. So I would encourage people to use them as well.
I just wanted to jump in here and say that Nancy and I have talked, and she's going to get us some masks for those that don't have any. We've ordered a lot of the type 1 masks, which are not, they're more disposable. They haven't arrived yet, but they're supposed to arrive this week, but we'll see on that. And we've also ordered some gator type masks that are going to be made locally, that are Bengal branded for our whole team. And those won't be here till mid-May, but they'll definitely be here before everybody comes back to campus.
Yep, and thanks. Jenny helped coordinate the face gaiters, so that's pretty neat. But anyway, there are masks available other places. I just got another good lead on some hand-sewn masks. So, but Cheryl, I'll work with you and the other directors of our departments in the division to get kind of some counts on essential staff. It would be nice if we could give you each 2 of them right now. I don't know if we have that many, so because you do need to wash them, and we'll provide some instructions on that as well. So.
Okay.
Thanks, Cheryl.
We have a question. As custodians, if we had a case on campus, would we have to clean and then close campus and possibly have hazard pay?
I could try a stab at this, and then Rex can bail me out if I'm wrong. The first one on hazard pay, again, I do not know if we have capability for hazard pay through the state system. I will take that to admin council and talk with Brian Sagendorf, and we will get back to the group, because I know we've had this question come up in the session earlier today as well. As far as if there was a case on campus, would we have to clean and close campus? I believe well, first of all, we probably wouldn't know till after you've already cleaned it once. And if you're if you're practicing safe hygiene, and you're cleaning and sanitizing the tables, chairs, whatever you're doing in your process, that should provide a level of protection for you. I don't know that we would close the campus. I'll let Rex respond.
Yeah. And I can jump in too about what happened in Meridian with our custodial team.
Yeah, I think that would be great, Cheryl. Part of the problem is we don't know that somebody had it until sometimes several days afterwards. And there are a couple of different factors that I guess go into the risk of somebody going into clean. Most of the evidence that we have says that the virus can live for about 72 hours on certain surfaces. Usually not any more than that. In some cases, considerably less than that time. So this doesn't persist in the environment for too awfully long. The other thing is that if we have adequate air exchanges in a facility, in a building, in a room, the risk of breathing in virus by working in that setting is low. And of course, folks that are cleaning would be using masks and using gloves to minimize the risk. The big risk of transmission is from person to person, and by far and away, over 80% of transmission is people in the same room for extended periods of time. Usually it's even family members. So transmission between family members is the biggest risk factor. And that's because they're in close proximity with people coughing and breathing and sneezing in close proximity to one another. But Cheryl, if you want to talk about what happened in Meridian after that case, it probably is a good, it's probably a good illustration.
Yeah, so we did, as Glenn said, our custodial team cleaned for 2 days before we realized. And then we did actually shut the campus down. Now, this was the first case in Idaho, right? So it was kind of very significant that it touched down on our campus. And then what happened there was the whole team pulled together and cleaned over the weekend. They cleaned Friday, Saturday, and Sunday with special, attention to all the touch points as you're already doing. They did not have the foggers like we have here available for someone to go in and fog after everyone's cleaned and to have that electrostatically charged cleaning particle that gets into all the crevices and things that I know some of you have to suit up with masks with the discs, with the special PPE to even use those foggers. So I think we've gotten better at it since then, but no one there got sick from that. And all I could say was I was so grateful that they were willing to go in and clean, because the fact is that in Meridian, that person may have touched down many times, and it's only one building, right? And here on campus, we have so many buildings and so many areas to clean. So I was very, very grateful to the team, and also no one got infected from doing that, because they did practice all the things that we've been talking about tonight.
Next question, would we consider closing campus for a long weekend, say a Monday or Friday, to let the virus die in the event of a case on campus?
I think it's a case-by-case situation. We have the emergency operations team that was meeting once, if not twice a day early in this process. Then it was meeting every morning, and now it's down to 3 days a week. And I believe that team would have a discussion depending on what the situation was. And certainly what you're suggesting is not out of the question, but we don't have a predetermined protocol for an infinite number of cases. Right now, we're handling each day as it comes, and each case is different. And so we don't have a set protocol, but that's something that I think we could consider depending on the circumstances.
I also wanted to bring up, and maybe Rex can jump in on this, is when we're cleaning for this type of a thing, it's where a person has been in this space. It's not where there's a sick person lying in a hospital bed, or there's a sick person that's been there for a long time. Usually they exhibit symptoms and then they leave and get tested. And we don't know about it because of the length of time it takes to get the test back, but it's not like they were there all that time.
Yeah, that's right. You know, again, the greatest risk is being in close proximity to somebody who's ill, not being in a place where that person was, and picking the illness up from a surface, whether it's a drinking fountain or a doorknob or a table where that person was, is really very uncommon overall. And so, yeah, it seems like a reasonable thing after what I just said. You know, let's just wait a few days and the virus is likely to die on those surfaces. And that, in fact, is true. In our dry climate, it's probably likely to dry up and die fairly quickly, because the reality is these viruses need to be kept moist, and they need to be kept you know, from one person to the next, right? It has to go from one host to another for the virus to replicate and grow and then cause additional infection. So this is not a bug that lives very well outside of the body, and for the most part, you know, we're pretty safe working in those kinds of environments, and that kind of transmission is rare. When we see what's happened in New York City, for example, where there's been over 200,000 cases, you know, these are people that are riding together in elevators and that live in very close proximity to one another, and even you know, walking on the streets. If any of you have ever been to New York City or seen how crowded the streets are and how crowded sidewalks are, even outside, because it's so crowded, there is a risk of transmission. But when we look at, you know, I think that's one reason we haven't seen as many cases in Idaho. We got on top of this quickly. We're very well spread out. We don't have the same kind of crowding in our apartment buildings. That's one reason we wanted to clear out the dorms very quickly, because we didn't want to have people living very close to one another. Both U of I and BSU didn't get their dorms cleared out as quickly as we did, and ended up with cases in their dorms and spread in their dorms amongst roommates and other people on the floors. I'm not saying we did it perfectly, and I'm not saying we won't get a case in the dorms, but we address that very, very quickly, because we know that the risk of infection is when people are together in close proximity, not so much from these other ways that we're concerned about spread.
If we were exposed by a family member with the virus and came into work after being exposed, would the campus close?
So again, that kind of depends on you know, when the exposure was, how long the exposure was. If we knew that a family member, if anybody knew that a family member was ill, I think that the family members that are in close proximity to them should self-isolate. They should not come into work. So if anybody knows that they have an ill family member, we should not be coming into work. And we would be getting guidance from the health department and from medical professionals as to whether or not you know, you should even go outside or mix with any other individuals. And the answer to that is probably not. So we would not want anyone to come into work if they had a sick family member who was known to be COVID positive.
And I would love to ask a question, if you don't mind.
Yeah.
The cloth masks that you wear to like the grocery store and out and about, how often are we supposed to wash those?
Nancy, do you want to talk about that? I know you've done a lot of reading on this.
So there is a CDC fact sheet out on that, and really you should wash it at night. You know, if you don't use it very much, like I will put mine in the sun and let it sit there and dry. I probably wash mine every 2 days. If I had 2 of them, I would probably switch them out and wash one every night. And then another thing to remember is when you put them on, you should wash your hands before you put them on. And then when you take them off, you should wash your hands again, and try not to touch the mask itself. You know, use it by the bands, or now there's not a lot of elastic, so they're just using straps. So that's what's recommended. So when we do provide these, there will be, I can send the link when I email Cheryl or whatever director's looking for masks. We'll send the link to the CDC guidance document, and it should be up on an FAQ site as well with some of this information as well. So So stay tuned.
Great. Thank you, Nancy.
Any more questions, Ginny, or is that?
Nope, I don't see any more.
Well, I want to thank Nancy and Ginny and Rex for coming in tonight and joining Trevor and Cheryl and I in our about every 3-month meeting with this group. And again, I can't say enough for those of you on our team for what you're doing for the campus and our campus community. I just really appreciate it. If you do have any questions after this, feel free to send them on to Cheryl. You can send them to me. You could also send them to finance@isu.edu. So I hope that the next one of these we have, I'll be able to bring in cookies. All right. Good night.
Everybody,
Thank you.
Thank you.
Thanks, Glenn.
Mhm.
Thanks
Thanks.
all.
Thanks. Thanks, everybody. Have a good night.
Bye-bye, you guys.
Bye.